Did you know that, according to a recent study published in the Journal of Clinical Endocrinology and Metabolism, nearly 50% of people with type 2 diabetes are consuming supplements without full knowledge of their impact on glucose levels? This fact is a wake-up call on the importance of being informed and choosing wisely when and how to incorporate supplements into our lives, especially if you live with diabetes. In this video, we are going to unveil the 7 worst supplements you should avoid if you have diabetes, based on recent scientific evidence that will help you navigate through this sea of often contradictory information. Number 1. Niacin, vitamin B3. Known for its role in the metabolism of fats and carbohydrates, it has a less favorable side for diabetics. Research has shown that high doses of niacin can significantly raise blood glucose levels, posing a challenge for diabetes management. This effect is due to its ability to increase insulin resistance. A study published in the Journal of Clinical Endocrinology and Metabolism found that therapeutic doses of niacin can impair metabolic control in patients with type 2 diabetes, suggesting caution in its use. For diabetics, it is crucial to limit the intake of niacin supplements to the doses recommended by a health professional and always under medical supervision. Considering natural dietary sources of vitamin B3, such as chicken, tuna, and avocados, may be a safer strategy to obtain this vitamin without running additional risks. Number 2. Vitamin B12. It is essential for the health of the nervous system and the formation of red blood cells. However, metformin, a drug commonly used to treat type 2 diabetes, can reduce the absorption of vitamin B12, leading to deficiencies if not properly managed. A study conducted in diabetes care indicated that prolonged use of metformin is associated with reduced levels of vitamin B12 in people with type 2 diabetes, highlighting the importance of monitoring these levels in patients using this medication. For those taking metformin, it is important to perform regular blood tests to monitor vitamin B12 levels. In the case of deficiency, supplementation under medical guidance is key. Dietary sources include meat, eggs, and dairy products, being safe and effective options to increase B12 levels. Number 3. Vitamin C. It is a powerful antioxidant that can benefit diabetics by improving glycemic control and reducing oxidative stress. However, very high doses could interfere with the results of blood glucose tests. A study published in the American Journal of Clinical Nutrition showed that supplementation with vitamin C significantly improves blood glucose levels in people with type 2 diabetes, suggesting its potential benefit as part of an integrated approach to diabetes management. Although supplementation with vitamin C can be beneficial, it is important not to exceed 1,000 milligrams daily and always discuss any supplementation with your doctor. Citrus fruits, tomatoes, peppers, and berries are excellent dietary sources of vitamin C. Number 4. Iron. It is a crucial mineral for oxygen transport in the blood. However, excess iron in the body can increase the risk of heart disease and organ damage in people with diabetes, as it promotes the production of free radicals and oxidative stress. Research published in the Journal of Clinical Endocrinology and Metabolism has found a correlation between high levels of iron and the incidence of type 2 diabetes, underscoring the importance of regulating iron intake. Medical supervision is essential when considering iron supplements. For those who need to increase their iron levels, it is preferable to do so through diet with iron-rich foods like lean red meats, beans, and spinach, complemented with vitamin C-rich foods to improve iron absorption. Number 5. Potassium. It is another essential mineral that plays a vital role in maintaining cellular function, fluid balance, nerve impulse transmission, and muscle contraction. In the context of diabetes, potassium management is particularly critical due to susceptibility to hypokalemia, that is, low blood potassium level, or hyperkalemia basically refers to high blood potassium level, both potentially dangerous conditions. Diabetics are particularly susceptible to these imbalances due to factors such as medication, altered glucose control, and compromised kidney function. A review published in the American Journal of Clinical Nutrition highlights the importance of potassium balance in patients at risk of chronic kidney disease, a common complication of diabetes. This research underscores how adequate potassium management through diet can positively influence the prevention and management of diabetic complications. For diabetics, it is crucial to monitor potassium intake, preferably under the supervision of a health professional. The inclusion of dietary sources of potassium, such as bananas, avocados, spinach, and apricots, must be balanced with individual needs and the state of kidney function. It is important to avoid potassium supplements without medical supervision, given the risk of hyperkalemia. Number 6. Caffeine. A stimulant found in coffee, tea, chocolate, and some energy drinks can influence blood glucose levels. Research indicates that caffeine can increase both blood glucose and insulin in some people after eating. For diabetics, this could mean greater difficulty in controlling their sugar levels. This was confirmed through a study published in Diabetes Care, found that caffeine consumption before meals can increase postprandial glucose levels in people with type 2 diabetes, suggesting a potential negative impact on glucose control. Caffeine consumption is recommended to be moderated, limiting coffee to no more than 200 to 300 milligrams per day, approximately 2-3 cups of coffee, and observing how it individually affects blood sugar levels. Personal monitoring is crucial, as the response to caffeine can vary from one person to another. Number 7, creatine. A popular supplement used to improve athletic performance, increasing the energy available to muscles during intense exercise. However, its impact on diabetics deserves attention, especially because it can influence glucose metabolism and kidney function. According to a study published in the Journal of Sports Medicine and Physical Fitness, evaluated the effect of creatine supplementation in people with type 2 diabetes, finding that it can help improve muscle strength and potentially insulin sensitivity when combined with a physical training program. Nevertheless, it is essential to consider the individual kidney state before starting supplementation. For diabetics interested in creatine supplementation, it is crucial first to consult with a health professional to assess kidney function and glucose control. If approved, start with a low dose and monitor any changes in blood sugar levels or kidney function. Supplementation should be accompanied by regular exercise to maximize potential benefits on insulin sensitivity. Supplementation can be a valuable tool for managing diabetes, but it is crucial to choose wisely. Avoiding these vitamins and minerals can help you maintain your health in balance and your diabetes under control. If you thought all vegetables were good for you, prepare to discover something surprising. Click right now on the video that appears on the screen and discover the 9 worst vegetables for diabetics. Not all vegetables are equal, and some could be sabotaging your glucose control without you knowing.